Senior Field Account Manager with United. I am in charge of employee engagement and education, so I'm very excited that you're joining here today. So here is your team at United Healthcare. Jennifer Boehm is the Senior Strategic Account Executive in charge of the renewal, and I'm in charge of employee education, reporting, and just employee engagement. So today what we're going to do is we are going to go ahead and learn about your benefits with United Healthcare. We are going to learn about topics to help you better understand your plan benefits, how to make informed decisions when you are using your benefits, and as a United Healthcare member, what tools are available and support that you can use to make better decisions. Our plans, again, are designed to help you save time and money and find the care when you need it. So today we're going to talk about some of the benefits you can expect being a United Healthcare member. Before we get started today, I always like to do a quick refresher on common healthcare terms, as insurance can be very complicated and there's lots of terms that we use. So a copayment is a fixed amount of money that you'll pay to a provider for a covered visit or prescription. So that could be a $10 copay to see a specialist or a $75 copay. Deductible, this is the amount that you would need to pay before your plan starts to share costs with you. This could be for an outpatient surgery. You will have to meet whatever deductible you have on your plan, and then what happens is you move into coinsurance. So coinsurance, what you've met your deductible, is the percentage that we will share with you. It could be that we pay 80% and you pay 20%. And then out-of-pocket limit. This is the most that you'll pay during your plan year, which runs from July 1st through June 30th, after which the plan usually pays 100% of those in-network services. If you want to learn more about those healthcare definitions, just go out to justplainclear.com, and then you can go ahead and review a lot of those different healthcare terms that are out there. So we always suggest that you prioritize your care that helps you stay healthy. So one of those actions that you can do is getting preventive care. Under all the plans with Douglas County School District, preventive care is covered in network at 100%. It's things like those checkups, screenings, and immunizations. It helps your stay healthy, and a preventive care visit is good to help you build a relationship with your primary care doctor so you establish it. It also is good for future guidance on medical needs because the doctor knows what it looks like when you're healthy versus maybe when you are sick. And you get to check up on your health when you're symptom free. So your doctor gets to know what you look like when you're healthy. We have a great pre-member website that is set up for you to explore all three plans with United Healthcare. The website is www.yuhc.com/DCSDK12. Under this website, you can explore your insurance options and compare all three plans to see which one is best for you. You can look at them side by side. You can even check to see which providers are in our network. You can learn about more programs that are embedded, like wellness and condition management. We will also talk about those further on as well. And we have a great open enrollment hotline at 1-833-410-2785 if you have questions. You can also reach out to your benefits office for any questions that you may have. First thing I want to talk to you about is one of the plans called the Colorado Doctors Plan. Some of the highlights of this plan is you don't need a primary care physician. You do need to select a primary care physician under this plan, but you do not need referrals to see a specialist. You also have behavioral health services that are available to you, and you have access to local medical groups, including Common Spirit Health, Advent Health, Health One, and Banner Health. This plan does not have out-of-network benefits. So if you go out-of-network, this would not be covered under your plan. So you want to make sure that you stay in network. Under that Colorado Doctors Plan, we have access to over 300 different access points in the Colorado Doctor Plan to offer you care when you need it, versus those acute care facilities, pediatric hospitals, maybe freestanding emergency rooms, behavioral health providers, primary care doctors, imaging centers, and much, much more, as you can see. So, under this plan, Douglas County School District, we've broken down the different hospitals so you can view them. Advent Health Hospitals has Avista, Porter, Littleton, Castle Rock, and Parker. Health One Hospitals have Centennial Hospital, Skyridge, Swedish, the Medical Center of Aurora, and Presbyterian St. Luke's. Our Common Spirit hospitals are St. Anthony's Hospital Lakewood, St. Anthony's Hospital North, St. Francis Hospital, Longmont United, and Penrose Hospital. Additional Health One hospitals also are going to be those Rocky Mountain Hospital for Children, Spalding, North Suburban Medical Center, and Rose Medical Center. We also have those hospitals that are specific to children, which is going to be Children's Hospital. They're located in Aurora, Colorado Springs, Broomfield, and even Highlands Ranch. Another point that I like to point out on this plan is that if you are traveling outside of the Colorado area, you have access to our larger network of providers with over 1.2 million physicians and over 6,000 different hospitals. So outside of the state of Colorado, you don't have that Colorado Doctors Plan network. You have our large nationwide network under the plan, and you have access to those providers to get the same care while you're traveling. This also applies to your students who may be out of state. They can use the tools available to them to find a doctor that is in network in the state they're going to school in. Now let's take a look at some of these Colorado Doctors Plan benefits. Under the Colorado Doctors Plan, you have in-network benefits only, as I mentioned. You are going to have a $1,000 individual deductible or a family deductible of $2,000. You have out-of-pocket limits of $4,500 individual or $9,000 family. The beauty of the Colorado Doctors Plan, though, is that we've removed some barriers to getting care, like having preventive care. Preventive care is covered in network at 100%. Going to see your in network primary care doctor is no cost as well. Seeing a 24/7 virtual visit, either online through myuhc.com or by accessing it through the United Healthcare app, is no cost for one of our virtual visit providers. Urgent care is also covered at no cost in network. To see an in network specialist, you have a $75 copay. And emergency care is covered at a 20% coinsurance after you've satisfied that $1,000 deductible or the $2,000 family. Some other additional care that I like to talk about is outpatient mental health visits. In network, there's no cost to seeing a behavioral health provider. For mental health visits that maybe are inpatient, those are subject to your deductible and then a 20% coinsurance up to your out of pocket. This would also apply to outpatient surgery, inpatient hospital stays, and physician fees associated with those surgical medical services. So, under the Colorado Doctors Plan, it's really easy to find a primary care during your enrollment. So, the first thing you're going to do is go out to that pre-member website. You're going to go ahead and click on Search for a Provider under your benefits and plans, and you're going to choose a UHC Colorado Doctors Plan. After being directed to a new site, a new tab will pop up, and you're going to search for people and then find a primary care. You're going to select the primary care doctor that you're looking for, whether that's an internal medicine doctor, family practice, pediatrician, or just a general practice doctor. Also, anyone enrolled in the plan can have a different PCP than maybe their spouse or their children. You just need to make sure they're in the Colorado Doctors Plan network. You're then going to select a provider and then search the info that shows them accepting patients and their in network status. You can also look at reviews to see how members have rated these physicians as well. You're going to write down the 14-digit provider ID number that you selected, and you will need this to enroll. You can also call the phone number once you're a member on the back of your ID card to have them select that primary care doctor for you. Under the Colorado Doctors Plan, choosing a primary care provider is required. One can be selected for the entire family, or each dependent can select their own, as I had mentioned earlier. This PCP must be located near your home of the employee. So the PCP has to be in the Colorado Plans Network in the state of Colorado. The good news is if you are traveling out of state or your children are seeing in another state for school, they can see a PCP in that state. They aren't required to see the PCP listed on their card. They just need to stay in the Colorado Doctors Plan Network. These doctors can be general practice, family practice, pediatrician, or internal medicine. You'll need that first and last name from the website and that 14-digit ID number so that a PCP can be assigned to you. If you do not pick a PCP, we will assign one to you, but no worries. You can go ahead and change that PCP by calling the phone number on the back of your ID card. Or once you're a member, you can go out to myuhc.com and select and change your primary care physician right on the website. Some additional reasons to have your PCP is, again, it's important for them to know your health history so they know what you look like when you're healthy versus sick. You have established that relationship, so it's easier to get in for that routine care like your annual checkups, immunizations, and also identify health risks that you may have. They can even refer you to a specialist. Under your plan, you are not required to get a referral to see a specialist. You just need to verify your doctor is in the Colorado Doctors Plan Network. And you can do that by going out to myuhc.com and signing in. Now let's talk about the other two plans available with United Healthcare. We have the United Healthcare High Deductible Health Plan and the United Healthcare PPO Choice Plus Plan. Both of these plans have both in and out of network benefits. You do not need to select a primary care physician on this plan, but we suggest you have a relationship with one. You do not need a referral to see a specialist, and in-network preventive care is covered at 100%. Also, I'd like to note, out of network, you are going to have higher costs, higher deductible, higher out-of-pocket, and you can be balance billed by those out-of-network providers for amounts above the allowed. So it's always best to try to stay in network to keep your costs down as you get the benefits of our contracts. Under these two plans, you have access to that large nationwide network plan in all the states. You have 1.2 million physicians that you can see under the plan and over 6,000 different hospitals. You can go ahead and go in network to receive care for services like doctor's visits, hospital visits, urgent care, and more. Now let's dig into the details of each of these plans. I'm going to focus on your in-network benefits, but I want you to know that both of your plans have in and out of network benefits, but staying out of network, you're going to have higher deductibles, higher out-of-pockets, and you can be balance billed. So starting with your high deductible health plan. So in network, you have an individual deductible of $3,300 or a family deductible of $6,600. Once you've met that deductible, you are going to have a 20% coinsurance up to your out-of-pocket limit of $5,000 individual or $10,000 family. Preventive care under the high deductible health plan is covered at 100% in network. Now moving on to that Choice Plus PPO plan. Again, both in and out of network benefits. We're going to focus on in network. This plan is a blend of both deductibles and copays. Your individual deductible is $1,500 or family $3,000. Once you've met that deductible, services subject to coinsurance are going to be paid at 80/20, which means that we pay 80%. You'll pay a 20% coinsurance up to the out-of-pocket limit of $4,000 individual or $8,000 family. Under this plan, preventive care is covered in network at 100%. Seeing your primary care doctor is a $30 copay. Having a virtual visit with a provider is a $15 copay. Urgent care is covered at a $50 copay, and a specialist is covered at a $60 copay. Emergency room visits are covered both in and out of network at a $250 copay. Behavioral health is covered at a $30 copay. And as I had mentioned, those services that are subject to your deductible, like inpatient stays, outpatient surgery, are covered at 20% after you have met your deductible. So we have great ways for you to find in-network doctors to keep your costs down. First, we have that yuhc.com DCSD K-12 website for you to search for in-network providers. You can call the phone number on the back of your ID card, or if you're already a member, you can look and find a doctor at myuhc.com. You can also search using the United Healthcare mobile app. If you're ever in doubt and need assistance, just call the phone number on the back of your ID card or the open enrollment support line listed on your screen. Now I want to dig into some of your health and wellness benefits that are embedded as part of your plan with United Healthcare. So the first thing I always love to talk about is myuhc.com. This is the website that you can access 24 hours a day, 7 days a week, and every UHC member should be registered to use this website. You can see what's covered under your plan. You can get find care and estimate costs, so you can find a provider, get estimates maybe on a surgery that you're going to have done. This is a really great tool if that service is subject to your deductible or you're on those high deductible or PPO plans. You can search for those in-network providers. You can check on claims and plan balances. This year, you can order prescriptions on MyUHC starting 7/1 of 2025. Your prescriptions are going to be offered through another vendor, and your benefits office can help assist you. They will not be through United Healthcare. Again, we're going to dig into that app. Once you register on myuhc.com, you need to download that United Healthcare app. This app is also great for your children who are above the age of 13 who can create their own account and use the app easily under their name. They can look at claims detail, look at their benefits, even compare prescriptions or compare providers and much, much more. They can even download their ID card right on their phone and have the ability to share it from their phone with their providers. So it is a great tool to have while you're traveling, away from home, and much, much more. One of the great plans I love to talk about is 24/7 virtual visits. You can have a virtual visit with one of our virtual visit providers. We have Doctors on Demand, Teledoc, and Amwell. Those are our 3 in-network virtual visit 24/7 providers. If you're under that Colorado Doctors plan, the cost to use that provider is 0. Under the PPO plan, you have a $15 copay. Under the high deductible, the cost of a virtual visit is only $54. So it's a great use of your healthcare dollars in your HSA. It helps you be a wise consumer. These virtual visits can treat you for things like cough, headache, sore throat, rashes, prescription needs. I always love to pick on my husband here. He ran out of his prescription on a Saturday. His doctor's office was closed, and we were able to have a virtual visit. They were able to call a 30-day supply of his maintenance medication into a local pharmacy. It was a great way to get his prescription so he didn't have to miss a day on his medication. And it's a very great cost as well. So it is a great way to do that. And generally, waiting for a doctor is less than 10 minutes. So it's a great way to get the care you need. Also, it's great nationwide. If you're traveling and away from home, you can have a virtual visit right from your phone. Also, under the plan, you can see a behavioral health provider anywhere, anytime. You can do this through the app or myuhc.com, and you're going to use our in network providers. Some of these in network providers offer virtual visits that you can go ahead and be seen, and you can either do it virtually or in network. This will fall under your behavioral health benefit depending on which plan that you're on, but they can treat you for things like anxiety, bipolar depression, neurodevelopment disorders, autism, even substance abuse disorders. You can also get in person care with these same providers. So you can do outpatient therapy, you can do virtual therapy. We also have inpatient care as well. We also have what's called express access providers, which means that these providers have opened up appointments within 5 days so they can get you into a behavioral health provider quickly if you need to be seen. Under your plan with United Healthcare, you have access to Calm Health. Calm Health is a free app, and we've partnered with Calm to offer you a great service. With Calm Health, you can get health and benefits through your mental health support at your own pace. So it's a self help app. It can help you find both happier and healthier you, and it provides you support along the way for both your mental and physical well being. It's a self-guided app, and you get to work at your own pace. So if you like to absorb things slowly or more quickly, you can work at the pace that fits you. One of the things I love about this app, it has um, a function for better sleep. I don't sleep well, but you can also listen to sleep stories while you're falling asleep. One of my favorite is those stories narrated by Matthew McConaughey. And who wouldn't want to listen to that voice in your ear while you're going to sleep? It can help you build skills to manage stress, help you develop resiliency. Our lives are stressful, and sometimes you hit that wall and you need that resiliency to get through. This app can help you build that. So you can start now building a mindful habit and download this app. This is available for all United Healthcare members, and it's completely free for those 18 and older. Another free benefit under your plan is a discount um, package to One Pass Select. So through United Healthcare, we offer a discount program for you to be able to join One Pass Select and have a gym membership that helps you build your healthy lifestyle. So these memberships are organized into 4 tiers from standard to elite and one digital tier only so that you have the flexibility to pick the cost and the locations that fit your needs. The gym network is nationwide, so depending on the tier that you're picking, if you're on vacation, you can use that tier in another state as well. And if you choose to go in person, you have access to thousands of gyms depending on the tier that you've selected. If you prefer to work out with your company, you can add also unlimited eligible members that are covered under your plan. They just need to be 18 or older, and they can get a discount on your plan as long as they are 18 or older. And you can get a 10% discount on their membership. For those of you who are planning on getting pregnant or are currently pregnant, you have Maven Maternity that's available to you 24/7. and it's available for those your pregnancy and postpartum. So it's available through your whole pregnancy plus 3 months postpartum. It'll walk you through all risk levels, offer you support in communication with the nurse. It will help you support your mental health needs as when you're pregnant, your body and mentally you're going through a lot of changes. You have access to information from doulas, also, if there's a miscarriage or a loss, they will support you through that as well. And they have partner support as well. Sometimes husbands are trying to keep up, and they're, especially if it's your first baby, and they will help you through that as well. They have live classes and articles and videos you can watch to support you throughout your program. Maven Maternity, again, is available 24/7. We have over 30 different virtual specialties and appointments for you to be able to join in classes. We target you through different channels to be able to support you in different races, sexuality, and languages. And also, it's a proven 12-month process to support you throughout your pregnancy. If you're having difficulty getting pregnant, we also have what's called fertility solutions. It's a great way to provide you the support while you're trying to get pregnant. So you can set up a call with a virtual nurse at the time that works best for you. You can get care from a specialist who has demonstrated the potential in increasing your chance of having a baby. So you want to increase those chances as well. And we have lots of learning modules to this program to help you get the answers on your fertility, possible treatment options as well, and how to cope with the challenges. As a Douglas County UHC covered member, you have access to what's called Hinge Health. It is an unlimited virtual physical therapy that you have no limit on the number of virtual physical therapy visits that you can have. It's creating a new way for you to access the healthcare system because it's built around members. And again, there's no cost. So if you meet clinically to be able to go ahead and do this, you can have virtual physical therapy with Hinge Health. You will then be walked through on the phone how to access and do those virtual physical therapy. They even track you with your phone to support you in doing those exercises. So it will walk you through that visit, help you do the exercises. It will show you a demo. And then also there's a daily playlist to keep you doing those physical therapy as well. It is a really great program. Another added benefit that I love to talk about is Teladoc Health. This is a diabetes management program to help you live a healthier life if you've been diagnosed with diabetes. So, through the Douglas County School District, we've teamed with them to offer you this free program at no cost, regardless of which plan that you're on. You will have access to expert coaching and coaches that will walk you through managing your diabetes. They will also support you through your journey, and maybe if you're on type 2 diabetes, help you on a journey to maybe get off those and improve your health to where you no longer need medication. You also have access to unlimited strips so that way you can test and make sure that you are going in the right direction. And you also will receive a meter that will connect. That way they can walk you through and get the information when you are testing. That way a nurse can reach out to help you if one of your tests are showing a high blood sugar. You can get started at no cost by going on myuhc.com. You can visit teladoc.com/register /UHC/key/DCSD, or you can call the phone number listed on the screen. And again, it's a completely free program. I know that we've gone through a lot of slides. We're almost done here, so thank you for hanging in with me. An advocate is available to you anytime that you are needing help. They are open from 8 to 8 through your regular business hours in Colorado. And they also give you the comfort of supporting you when you call in, whether you need help understanding a benefit, a claim, or even a bill that you got in the mail. you need to find a provider with the Colorado Doctor's Plan or your child's out of state. Just call the phone number on the back of your ID card. They're there to help you get the information you need. You can also chat with the provider on myuhc.com, and you can chat with an advocate. So now that we've done our presentation, we have those pre-member websites set up at yuhc.com/DCSDK12. You can call our pre-enrollment line at 1-833-410-2785. I want to thank you again for joining the presentation. I'm going to pause now to see if we have any questions.